Heart disease is the leading cause of death in both men and women. But there's good news. It's preventable. Here to help us with tips for a heart-healthy lifestyle is Dr. Nicole Swiner of Durham Family Medicine. And welcome, doctor.
Thanks for having me.
Well, I think I have a pretty good heart. I mean, is there a way I can tell? I mean, just that it's okay and I don't have to come see you?
I mean, in general, as long as you're doing pretty healthy things on the regular basis, like not smoking, not overusing alcohol, regular moderate exercise, in general, most of us have pretty healthy hearts. But it's the unhealthy heart that you have more difficulty telling because it can be a silent disease or a silent killer.
I think it's pretty much common sense, isn't it, folks? You know, if you're doing things that are unhealthy, your body's going to react to that. But for those of us who try to do everything right, well, even those who are cheating a little bit, are there signs that you're having an issue with your heart that might get you to call a doctor?
Yes, so those classic textbook signs or symptoms would include chest pressure, chest pain, like an elephant sitting on your chest, particularly if you're feeling it at rest or not when you're moving or doing anything with exertion. Significant shortness of breath or more shortness of breath with doing your regular activities. Swelling can occur with certain types of heart disease, so having a significant, we all swell maybe just a little bit, especially when it's hot or you've been on your feet for a long time, but having, double or triple sized swelling in your legs can be a sign of heart disease. And just sometimes general malaise or more fatigue than usual with doing your normal activities.
Can I ask you to define maybe what heart disease actually is? Because I think heart attack, but I know, of course, that's probably part of it, but there's much more.
So heart disease is a very broad term, but in general, it means anything that can cause dysfunction of the heart. So heart attack could be a result of heart disease, or artery disease, meaning clogging of the arteries from lack of blood flow or increased cholesterol. Not getting good blood flow to the heart can be a cause of heart disease, but it can show itself in different ways. There's also congestive heart failure, which is a type of or result of heart disease. Stroke can be caused by heart disease. So it is a very broad term.
Now, as a doctor, how do you diagnose something like this, especially if it's someone who thinks they're healthy and they come in and, I have my physicals, I'm sure everybody does or should have anyway. How do you pick up on all of these? Really, there's so many variables here.
For most of our adults, especially if you have a significant family history or you have another risk factor like high blood pressure or you're already a diabetic or significantly overweight or obese, for most of my adults during their annual physicals, we're doing EKGs or electrocardiograms, which is, you put the stickers on the chest and the legs and you look at the rhythm and the rate and the kind of electrical current of the heart, and that can show signs early of heart disease even if you're not having symptoms. If you do have any of those symptoms that you are worried about, some of the chest pain and shortness of breath issues, plus or minus a family history, you can come in kind of requesting an evaluation, and some of that may include either an EKG or even an echo, which is also called an ultrasound, to look at the actual movement and blood flow of the heart supply. And then some blood testing, lab markers can be elevated in certain types of heart disease, like sedimentation rate, or there are other types of inflammatory markers that can be high if you suspect that a patient may have heart disease.
Now, it attacks both men and women.
Yes.
Are there differences between the genders when it comes to heart disease?
There can be. Classically, some of those elephants sitting on the chest or a feeling of pressure or squeezing or pain may not necessarily happen for women. Some women have some of the more non-traditional symptoms, like we mentioned, feeling kind of general malaise or fatigue or having more shortness of breath with their usual activities, or even abdominal pain or back pain can be associated with heart symptoms for women.
This is a silly question, but how do you know if you're having a heart attack? It seems like it would be obvious, but I mean, I felt some pain over here every now and then, but you can write it off as either, indigestion or whatever. How do you know? How do you know when you're having one?
So again, textbook, there's a difference between textbook or what you see on TV versus, what can happen frequently. But for the most part, it's left-sided chest pain or feeling a pressure, something sitting on the chest. It may radiate to your shoulder, your left arm, your jaw, your back, sweating, dizziness, nausea, maybe even vomiting. And just a significant amount of pressure. That's the classic, trigger. Those are trigger issues for heart disease patients or calling someone 911, if you're thinking you're having a heart attack. But again, it doesn't always have to occur like that. It can be a significant amount of abdominal pain and nausea. It can be shortness of breath and not being able to catch, your breath as you're speaking. So it's hard to tell.
When you've been diagnosed with possibly having some issues, is it reversible? I mean, how is it treated?
So heart disease in general, so if we feel that you have some dysfunction of part of your heart muscle, whether it's not pumping enough or getting enough blood supply, or we think that your arteries may have blockages or cholesterol buildup, it can be reversible. Sometimes it takes procedures to clear out, kind of rotor-rooter some of those arteries if you see a cardiologist, or if we think that your cholesterol is really high and you're building up plaque by taking some of the cholesterol drugs or changing your diet, you can, in some ways, at least stabilize the blockage or stabilize the plaque. A lot of heart disease and stroke is caused by the arteries building up with plaque and buildup, and then it breaking off and moving to a different place in the body, a different place in the heart. There are ways to stabilize the plaque. You may not be able to erase all of it, but there are ways to at least stabilize it so it's not as likely to break off and then be thrown into another part of the heart and cause a heart attack.
I know you mentioned right at the beginning of the segment, unhealthy things. How important is diet when it comes to not only keeping the health of your heart, but treating heart disease?
Extremely helpful. So, we have a slew of Popeyes and Bojangles and McDonald's on every corner now, unfortunately.
You got me hungry.
Right. And
yes.
it's, easy. We, roll in, get some food for family and go home and eat. But it's very, very important to not overindulge in fatty, fried, greasy things that are going to literally cause, cholesterol buildup in your arteries. You can imagine the grease that you see on the food literally is going to congeal and can clog the arteries, which I know is horrible to hear, especially in the South. But we have to be careful.
So good.
I know.
So good.
I know. That's the evil. That's the evil part of it.
Is.
But it is. I mean, you can do things like what we're trying to do in my household is cook more now at home versus eating out or eating fast food. And fast food isn't always the problem. Sometimes it's just you can go to the most wonderful restaurants. And freshly cooked things as much as you can, but you can't control how much oil or what kind of salt, how much salt is being put into those foods. So if you can manage a lot of that more at home, then you can be in control, into what goes into your food and what goes into your body. It's very helpful for prevention.
It can be tough. It can be tough.
Yeah.
Well, don't go anywhere. We got more to talk about. In fact, one that I'm a little nervous about, and that's this flu season that we're experiencing right now. So when we come back, we'll talk about that. The colds, the crud, the flu, all coming up. Stay with us.